If you gotta start somewhere, why not here? If you gotta start sometime, why not now?
We'd like to begin by first thanking Kenny Blackshirt, the Resident Program Director at the Marion High Rise. Additionally, we'd also like to thank Lori Marsh, the Marion High Rise caseworker, Ina Goldrina, the Russian interpreter, Mary Bloomberg from the Atlanta Regional Commission, Eve Bird from Fuqua Center for Late Life Depression. Without their help and participation, our project would not have come to fruition.
Our population were the residents of the Marion Road high-rise located in Buckhead, Georgia. It is a naturally occurring retirement community, also known as the North. The residents are predominantly Russian and Korean elderly immigrants. We also have disabled Americans as well as Chinese and Spanish individuals.
We were made aware of some community health promotion needs by our community partner, but also through initial site visits. Some of the needs we noticed included transportation for our residents, such as transportation to places where they could get healthy food choices or foods that they preferred. Since there is a quick trip across the street and a Target, however, that might not be the place that the residents really want to go to get their food, especially considering the cultural background of our population. In particular, we were able to discern that social isolation could be a major factor in the nutrition of the elderly residents at our NORC.
So one of our initial intentions was to build rapport with the community. Because Emory had not established a relationship with the community previously, we wanted to establish a groundwork for future interactions. We went with the intention of assessing some of the needs of the community and meeting the residents who were there. The reality of the ice cream social is that it was primarily attended by English-speaking residents. So that gave us a great opportunity with many people to speak to, but left out some of the populations that we might otherwise want to address. In order to establish the needs of the other community members, we looked at previously conducted needs surveys, and we also spoke with our community partners.
So based on the previous literature, we wanted to address social isolation and nutrition at our NORC. This was also supported by a number of other pieces of literature that we found. They found that actually by addressing nutrition through socialization and social meals, that you can actually increase the caloric intake. So Keller in 2006 studied socialized meal programs such as Meals on Wheels or congregate dining, and found that seniors who were involved in either of those actually had less of a nutrition risk than seniors who were not. And then there was also a study by Locker, Robinson, Roth, Ritchie, and Bergio in 2005 that looked at the impact that the presence of someone else would have on the caloric intake of seniors, and found that when someone else is present during the meal, seniors will actually intake more calories. So we thought that a congregate meal program would be a great way to address both social isolation and nutrition.
The Determine tool is a nutrition screening tool. It's basically a tool that just assesses for malnutrition in the elderly. It takes into account if people are having financial difficulties buying food. It also takes into account what types of foods people are eating, so it asks questions about their diet. It also hits on isolation by asking if people normally eat alone. And we altered the survey slightly to make some changes that we felt like would make it easier for our population to understand the questions. And one question we did change into 3 separate questions that we felt like made it a little bit easier for them to differentiate what we were talking about with that question. And then we did add a question at the end to see if people would be interested in attending group meals if they were offered here. So that was how we changed the survey to adapt it and make it feasible to administer to our population, and how we felt that it would best assess what we were looking at.
We're confronted with a language barrier, and it became necessary then to translate our Determine survey, our food survey, nutritional assessment survey. We had to first coordinate with our on-site activity coordinator, his name is Kenny, an appropriate date and time to show up and go floor to floor, knocking on the residents' doors. One thing that we discovered though is that it ended up taking a lot more time because the residents were so excited to see us, even if we couldn't really speak the same language. We were invited into their rooms and had a good time with them, but realized that we weren't able to ask every resident in the facility to fill out our surveys.
So we completed our survey collection at Marion Roads, and we ended up getting 66 surveys completed by a number of different participants and compared answer responses by language group. But we really focused on 2 questions from our survey: the question of whether people eat their meals alone, and whether they were interested in participating in a group meal together because of the interest of our project in looking at social isolation and nutrition.
Fortunately, a few of our team members' families were really generous with their donations and were interested in helping us out, so that's how we were able to raise the funds to buy the groceries. A part of the group went out to a grocery store and bought all the ingredients, and then the night before the actual serving of the dinner, we met at Thasha's house and cut up the vegetables together, and arrived the next evening, and we prepared the meal, and we had a great turnout.
One of the things that we do here at Marion is try to make sure that the residents are able to maintain themselves and live independently. Throughout those years, we've worked with several groups, several different youth groups, older groups have come through, and some stay around for a minute, but really look forward to this collaboration with Emory. Y'all came in with a lot of enthusiasm, a lot of good ideas, ready to work. So I like that. I think the residents kind of received it pretty well too.
Our group focused on patient-centered care because we really had to think and work before we did. We took like a month and a half to get our project together. We had lots of ideas, but none of them were actually based on the patients. Specifically, they were based on the stereotype for that generation and the group. So when we actually thought about what they wanted and what they needed, we decided to do the assessment and find out from them. It'd be better to find out from them in person. So we did the assessment, gathered the data, and then we were able to pinpoint specifically what they needed from the data and what they wanted. And so we took that along with the assessment data. We provided them a service. Their contact person mentioned that people come and assess, and then don't follow through with something. And so we were able to also give them what they needed. So it worked really well together, what they wanted and what we were able to give.
So I think that this project really helped people to develop skills and cultural competency, because we had to work with senior residents who we were unable to communicate with. I think a lot of people don't realize all of the challenges that go along with working with people when there's a communication barrier. Communication has been shown to be the most important part of healthcare and responsible for the most errors, so I think that this project allowed people to see the challenges that truly come along with that, as well as ways that you can try to overcome those challenges, like having your information translated into multiple languages. And I think people really learned that smiling and being very friendly and receptive and open can go a long way, as well as being culturally humble.
If we gotta start somewhere, why not here? If we gotta start sometime, why not now?